big warm welcome to the second episode of the Canine Connection. It's great to have you here to join us, and thank you everyone for your continued support and listening. I wanted to wish everyone a very happy new year, and I know it's going to be a fantastic year for the best possible pet care we can offer our canine companions. I'm your host, Victoria Morris, animal trainer and behaviourist, and I'm so happy to be talking to professional vet Dr Andrea Del Carro. I've had the pleasure to know Dr Del Carro for many years, consulting with him on behalf of my clients and their dogs, and there was no better person I could think of to have a podcast with on our special subject, puppy health. So listen closely and watch out for his great advice and tips. It is, of course, that time of year when many people have chosen to welcome a puppy into their home, or they're deciding to look for a puppy. It's an exciting time with lots of questions in mind, and we really want to know the good things that we can do for our puppy's health. So welcome, Andrea, to the Canine Connection, and thank you so much for joining us today.
Hi, Victoria. Thanks to you for the invitation. I'm really excited to participate for first time in my life in a podcast.
I'm so happy to have you here. I was thinking, actually, Andrea, the first thing I wanted to ask you was maybe you can tell the listeners a little bit about yourself.
Yes, I'm a vet since 2009, and to be a vet was my childhood dream. So I decided it was really early in my life. I was 6 years old when I decided I want to be a vet, also because I grew up in countryside in a little farm. So I was surrounded by cats for sure, but even other farm animals like goats, sheep, little ponies. So.
Gosh, it sounds like a fantastic childhood, and of course gave you a lot of diversity in terms of working with the various different animals as well.
Yes, for sure. But when you're a vet, you're allowed to work with all species. But nowadays, you need to choose between small animals, equine medicine, or farm animals. So I decided to work mostly with dog and cats.
Great. And where did you take your studies, Andrea? Where did you go?
I got my vet graduation in the Veterinary School of Milan in Italy. And after 1 year of work in Italy, I decided, and I had the chance to move to France, where I spent 1 year as in internship in a big veterinary hospital close to Paris. And then I decided to specialize myself. So I moved to the vet school of Lyon for a post-graduation specialization.
Fantastic. So you did quite a little traveling. And what made you decide to come to France?
Well, I didn't like totally to work in Italy at the time. There were many vets, so salary was not so good, and I was working as employed in a little practice, not really satisfying as a profession. And I had some contact from a previous stage I did in France. So when I decided I didn't like Italy, I just called my contact, and luckily there was a place for me in Paris.
Fantastic. And it's good to widen your horizons, and obviously very good as well for you to pick up the French language. So obviously now you have the Italian, the French, and obviously the English, which is great.
Yes, when I moved to France, I was not a good French speaker, but working in France helped. And I really improved my English moving to the French Riviera. As you know, there are many English speakers, native English speakers here. So it helped to improve your English.
Lots. And of course, the best way to learn a language is really to immerse yourself in it as well.
When you're obliged to use it, yes you learn it.
Well, I was going to ask you, Andrea, do you have like a special area of veterinary science that you're most interested in?
Yes. During the 3 years I spent in Lyon, I made this post-graduation training called the residency program. Okay. And after that, I was allowed to attempt a specialization exam. So now since 2014, I'm specialist in small animal reproduction, European specialist.
That's brilliant. And does that allow you to do research within the area? And what does that
You need to do research during your training.
Yes.
Because you're evaluated also about your research.
Yes.
And once you are a specialist, you need to attempt congresses, sometimes very high-level congresses, to learn what's new in your field. But you get also a few invitations as speaker. So I was lucky. I spoke in many European countries.
Oh, that's a great experience. And I'm guessing that you're picking up a lot. Is the science advancing a lot? And do you generally meet in the Congress sort of once a year, or?
Yes, science is evolving. Well, if I speak about my field, small animal reproduction, but sometimes it's evolving in very academic way, and then you need to get what you can do in your daily life, in your practice.
Applying it to your everyday practice, yeah, absolutely. And you were talking to me earlier on that you have now a new practice. You have a practice in Menton.
Yes, after working, I worked 8 years as freelance close to Monaco in a private practice, and 1 year ago I saw a place I like it in Menton. I live in Menton. I like it, so I decided to open my own practice.
So you've had a great start to the new year.
Yes,
Lots of changes and lots of exciting things going on.
for sure.
Yeah, and yeah, you'll have to give me all the links for the pages as well, because I'm sure there's going to be listeners and they're going to want to see where you are and find you. But do you have a little team working around you at the moment?
We are a very small team for the moment because me and my wife is helping me, but I'm gonna hire soon a student nurse, a very motivating young lady, and I'm collaborating with a diplomated physiotherapist for animals. She has
Great.
special title, and in case of some problematic dogs, mostly I can collaborate with some behaviorist.
Yeah, yeah. I was going to ask you, what types of services do you offer at the clinic?
Oh, we can split into different services. There is the general practice for
Yes.
when doing consultations for pets mostly,
Yes.
and we have the equipment to do X-ray, ultrasound,
Yes.
soft tissue surgeries,
Yes.
and on the other service I offer, it's for my special activities. So I work mostly with breeders, and they can manage case of infertility, so assisted reproductions, and we also have a semen bank for dogs.
Great, great. And you have lots of different companion animals coming to see you.
Well, mostly dog and cats.
Mhm.
In this area, we don't have so many small animals like ferrets, rabbits, guinea pigs, but sometimes they're coming, yes.
Yeah, yeah. And do you have a favorite companion animal that you like to treat?
I'm dog person because I grew up with many dogs, but
Yes.
since I start to work, mostly thanks to some colleague in Paris, I got more used to cats. It was some species that I didn't know properly how to interact with them, and they are really fascinating. So no, I like to work with cats as well.
Great, great. Yeah, actually, thinking about that, I would love to interview you for another podcast that I'd like to get together at some point called the Pet Connection. So maybe we can have a bit of a chat about other companion animals. But I wondered, well, you've already actually told me this. Your favourite really to work with is really the dog and the cat, and that's mostly what
Yes,
you're getting
I like
into
to
the
work
clinic.
with them, and I work 80% of my working time is with dogs and
With
cats.
dogs, yeah. And are you finding a lot of puppies coming in to see you at the moment?
As usual, when it's the end of the year, Christmas is coming, people
Yeah.
are more open to adopt puppies.
Yes.
So I had few new clients with puppies, but it's nothing compare after the post-COVID time, because
Yes.
during COVID and the months after COVID was really crazy. Everyone was adopting puppies and kittens.
Yes, yes, I know. I was just going to ask you, I mean, many people, when they're looking for a puppy, they don't really know where to start. And I wondered, obviously I know that you're involved with breeding and your wife too. Do you consider there are any special considerations in terms of what people need to keep in mind when looking for a breeder? Also, are there any potential diseases, things that diseases that breeds are particularly vulnerable to? I've got in my mind sort of hip scores, eye scores. Are there certain aspects that people need to keep an eye out for?
I would say that the first step is to read and get information about the breed you like, and
Yes.
just try to understand if it's compatible with your lifestyle,
Yes.
your house, your place. And if you decide a breed, then start to look for a breeder. And for me, the first point is meet the breeder and start and see if there is some connection with him. Because I think that the relationship between new owner and breeder is very important. If you don't feel comfortable, if you don't trust your breeder, just change.
Yeah, I totally agree. I think you can tell a lot by the questions that they're asking you, and when you initially make the contact. And I think when you go and visit, there's obviously a rapport there. So yeah, I could completely agree. Are there any sort of potential health signs that when somebody's meeting the parents of the puppy that they should look out for?
For sure, you can have many signs, but sometimes the eye of a new owner is not used to see these signs. So I will say that something that everyone can see is the character of the parents. So try to see them, meet them, and have an interaction with them,
Yeah.
because it's a sign of what they can give genetically to the puppy, but also it's a sign if they are growing and living in a good environment for their character. And then for sure, if you are speaking with the breeder, ask a copy of the health test. Every breed has specific test and a good breeder can provide you a report that the parents are healthy. Unfortunately, it doesn't mean that the puppy will be healthy, but it's already a good base.
Sure. And is there anything else that you can think of in terms of, other than hip and eye scores, are there any other sort of tests that people should be looking out for?
Hip and eye score are the most, I would say, popular disease known by the owners, but the veterinary medicine improved a lot, so we have more and more genetic disease, for example, and we have more and more tests, for example.
With the science moving forward as well.
Yes, and the advantage is that for many of these diseases, there is a simple genetic transmission. You know that the parents are free, you can be sure that their puppy will be free.
Yes.
And you can do that because it's not really hurting the puppy. You can do the test even very early to get a result.
Yes, yes. And obviously in the UK we have the Kennel Club, and in France obviously we have the SCC, and that they provide guidelines for breeders, and obviously people who are looking for puppies can contact them in terms of finding good breeders. Is it your opinion that these organisations are providing good guidelines for breeders? Did you have any feelings about that?
Yes, they're giving the kennel clubs, national kennel clubs, they're giving guidelines. But in most of the countries, if we are speaking mostly about south of Europe, as Italy or France, there is nothing mandatory. To be a breeder, professional breeder, it means that you're paying your taxes.
Okay.
And it's up to you if you want to follow the guidelines. And the problem we have in few countries is that now you have guidelines from kennel clubs. And if you are speaking mostly about some welfare of the animals, or some hyper type, with very short nose breeds. In few countries, the politicians are making laws about that. If you speak about Norway, Belgium, Netherlands, and sometimes there is a conflict between the guidelines of the Kennel Club and the national guidelines.
Okay.
And it's a real problem in Norway, for example, where you are obliged to spay your dog and your cat, or in Netherlands, for example, where if you have a bulldog, for example, or a pug, if the length of the nose of your bulldog is less than 1/3 of the length of the skull, it cannot reproduce.
Okay.
But for Kennel Club, that is a ugly bulldog or ugly pug. So it's really contrast between them.
Yeah, which probably doesn't help very much. Yeah, and so how are the organisations such as the kennel clubs? How are they regulating breeders? It's just really a set of guidelines, but you can't obviously be assured that those guidelines are being followed, or.
If the breeder decide to follow the kennel club, you need to follow the guidelines.
Okay.
And depending from the countries, it can be very strict, as in Scandinavian countries, or can be very flexible, as in Italy or France.
Or France. Okay.
But at least if they are following, it's helped to have good puppies and healthy puppies, technically.
Yeah. And when clients pick up the puppy, is there anything that you would recommend in terms of health checks? And what types of things are you looking for when they bring their puppy to you?
If the puppy is okay, what I suggest, don't take the puppies to the vet the first 3-4 days, because the change of house can be a little stress. So let's not add another stress. Yeah. But after 3-4 days, when the puppies start to get used to the new family, the new place, they can go to the vet. For sure. The most important point when you're working with a puppy is to get a good histories. So you need to check if the puppy is eating properly. Sometimes on toy breeds, if it's taking weight.
Yes.
Any history about normal poo, some diarrhea, and previous treatment about concerning parasites, internal and external parasites. And as vet, what I'm checking firstly, some congenital faults, open molera or something like that. And I'm checking, mostly in France, because it's mandatory, the health certificate. Because in France, when you're taking a new puppy in your home, the breeder must provide you a health certificate. So I'm trying to compare what I see in the puppies, what the colleague wrote.
Perfect. Yeah. And what are the legal requirements for owners in France and Italy? Obviously, a client will come to see you, and obviously that you have to look at the microchipping and the identification. Just talk us through that, and also perhaps according to breed. Obviously the legislation with breed according to the UK, France, and Italy. Obviously there are some differences, but maybe just give us a little bit of an idea.
In France, Italy, and UK, we don't have, for example, forbidden breeds. If you go to Switzerland, you have a short list of breeds that they cannot exist in Switzerland. In France, there is a short list of categories breeding. It concerns breeds like pit bull type,
Mhm.
or even Tosa Inu. I don't remember all of them, honestly.
Yeah.
American Staffordshire, Tosa Inu, Rottweiler as well. So
Yeah.
if they have a pedigree, the owner can keep them. If they have no pedigree, there are some rules to respect. You are obliged to keep them on the leash. You're obliged to spay them. You're obliged to vaccinate them against rabies. And sometimes the owner is obliged to have a course and have a license.
Very good. Yeah. Totally agree with that one. Yeah.
From the other side, when a family is adopting a puppy, the puppy should have a microchip, because it's up to the breeder to put the microchip, and the breeder should take care then of the change of ownerships, like when you're buying a car, let's say.
Yeah.
In France, there is something more. As I told before, the breeder must provide a vet certificate with detailed clinical exam of the puppies. And since 1st of January 2022, I think, the breeder or someone who has this certificat de capacité, so can be breeder or vet, must deliver to the new owner this proof. It's a certificate when the owner knows the needs of the animal. And technically, this certificate must be signed at least 1 week before adopting the puppies. It's just to stop, it was made to stop this compulsive puppy buying in front of a pet shop.
Yes.
And from this year in France, even to sell dogs and cats in pet shop, it's forbidden.
Okay. Yes, I didn't know
Something new from 1st of January.
Yes. Okay. Great. Yeah. And again, agree with that. I was also going to ask you, obviously, right in the forefront of many owners' mind is obviously the puppy vaccinations. Obviously, the breeder is going to do a certain number of those vaccinations, but puppy owners also have a few more vaccines to do, obviously, when the puppy arrives. So I just wondered if you could maybe talk the listeners through the vaccines. So obviously, we have the rabies and we have the yearly booster, which is the distemper, and maybe you could just talk everybody through that, because it's quite a minefield if you haven't had a puppy before and you're thinking about, all the different vaccines you have to do.
And things changed a little bit in 2019 because the World Veterinary Association made new guidelines about vaccines.
Okay.
So nowadays, the recommended protocol is that the puppy should be vaccinated at around 8 weeks, 2 months old, with a complex vaccine who is protecting against parvovirus, canine distemper disease, herpes virus, adenovirus, and parainfluenza. Then 1 month after, there is a booster. In this booster, so around the age of 3 months, in this booster you can include the leptospirosis as well. And what is new based on these new guidelines, that there is a third booster to do at the age between 4 and 5 months of age.
Yep.
Because it seems that if you do only 2 vaccines, 2 months and 3 months old, there are not enough antibodies.
Antibodies, yeah.
And then there is a booster at the age of 1 year. Concerning other vaccine, the rabies vaccine, it's mandatory only if the puppy is leaving the country where he was born, and it must be done at the age of 12 weeks by law, and the puppy can leave the countries 3 weeks after the rabies vaccine.
Yeah.
From my point of view, if the owner has no needs to travel, I prefer to do rabies vaccine a little bit later.
Yes.
Around 5-6 months when the puppy is a little bit stronger, with a better immunity. Just to make
if there's no need to...
immunity storm when they are 3 months old.
Yeah, exactly. And are there any special considerations in terms of breed and the size of the puppy? In my experience, seeing vets, sometimes if we have a smaller breed puppy, maybe it's a little bit more fragile, not quite as hardy as some of the bigger breeds, that maybe you'll separate vaccines on different days.
I know that few colleagues, they are separating vaccine. I'm not doing that. I really want to be sure that the puppy, mostly in toy breeds, it's really healthy. If I have any doubt, I prefer to wait a few days.
Yeah.
In my experience, yes, I have few brands that they have more side effect on little puppies, on little breeds puppies. So I try maybe to use mostly inactivated vaccine, because they have for sure a little bit lower stimulation for immunity resistance, but they have less excipients, so less side effect for the puppy.
Okay, that's good to know. And obviously, clients can chat to their vet and see what is the best option at the time. What
is sometimes popular, unfortunately, in France, that my colleagues, they're doing all vaccine the same day. So maybe booster of a complex vaccine at the same day of rabies, and this is for little puppies, small breeds, sometimes it's really too much.
Just way too much, yeah. Well, we've really covered a huge amount in our first part. I think we're going to separate it into two parts and give people a little bit of time to absorb everything that we're talking about, because it's a super exciting subject. And like I say, we're covering an awful lot for puppy owners to take in. So yeah, really looking forward to seeing you, Andrea, shortly, and we'll cover our second part of the interview.
Yes, I think we gave so many information now. We need a break, and even who is listening to us need a break.
I think we need coffee. Yeah.